We've all heard stories about challenges consumers face when shopping for insurance coverage in the healthcare exchanges. To discover what consumers are experiencing firsthand, we went on the healthcare exchange and searched for basic information about health plans. The Partnership to Fight Chronic Disease, a coalition representing more than 100 different healthcare stakeholders, is focused on raising awareness of the human and economic toll of chronic disease and advocating for health reforms that lessen that burden. For all consumers, but particularly for people with chronic diseases, having good health care coverage is critically important. There are many questions consumers want to answer. Two basic ones are, can I keep my doctors, and are my medicines covered? To see what a consumer has to do to learn about her options, we search for health plans available on Connect for Health Colorado, the state insurance exchange. To search for plans, we had to look under New Customers and then select Shop Now and Browse Plans. We search for plans in Boulder, zip code 80301. We entered a birth date for a 51-year-old and identified as a non-smoker, single-person household looking for health care coverage. 57 plans are available in that zip code, offered by 6 different insurance companies. First, we narrowed our options to just silver plans since those have been the most popular with consumers. There are 25 silver plans available. We looked at the silver plan with the lowest premium to find a list of covered medicines. It was great to see a link to a preferred drug list up front. That link opens up a 2-page list of medicines. The disclaimer at the top of the page notes that the list is just a list of the most commonly prescribed medicines, an abbreviated form of the covered drug list. Nothing is said, however, about how to access the full list of medicines covered. The medicines are organized by therapeutic classes. Some of the names used are consumer-friendly, like cholesterol-lowering agents for cholesterol-lowering medicines. Other terms, however, are not. Antineoplastics are used to describe cancer medicines, and non-insulin hypoglycemic agents are used for some of the commonly used diabetes medicines. The list does not give any indication of the out-of-pocket cost for the consumer for the medicines. To find that information, a consumer needs to go back to the exchange and look at the summary of benefits for this plan. We wanted to find the comprehensive list of medicines for this plan and to make sure we were looking at the right list. After some trial and error, we found help in the Summary of Benefits document. There is a link listed to find information about covered medicines. We tried the website from the document. That took us to the insurance company's homepage. It took some experimenting to figure out what we needed to do and how we needed to select our plan type under Our Plans on that page. We then were able to locate the formulary for 2015 on the next page. Then we tried the Search Online function. We finally found the list of covered medicines. In fact, we found 7 different files of covered medicines, each featuring different groups of covered medicines. This is very confusing for consumers. We went back to our search to see what we needed to do to find a list of covered medicines from the next least expensive premium silver plan from a different insurer. We started with the handy preferred drug list link under the plan. We clicked on Find out what drugs are covered. There were 7 options. The first referred to the Colorado Marketplace, which could mean Connect for Health or the exchange, but there was also a link to an HMO formulary, and we knew our plan is an HMO. We tried the Marketplace formulary, and by the language included in the front of the document, this was the right choice. The medicines are organized by therapeutic classes, using technical medical terms that are not consumer friendly. For example, a consumer would need to know to look under anti-neoplastic agents to find cancer medicines. Some commonly used asthma medicines are listed under this technical term. Though this insurer provides a more complete list of covered medicines, it's not presented in a consumer-friendly way. The exchange website also allows a consumer to compare plans and costs by selecting 2 or more plans and comparing them. We selected the 2 silver plans we were researching and looked at the comparison. It's handy to compare premiums and deductibles up front. The tool also provides information about other charges, but often that information conflicts with other information available on the exchange. For example, the comparison tool says that there is no charge for provider visits with out-of-network providers. Other information on the exchange says those visits are actually not covered at all. Also, the comparison tool says that medicines prescribed by out-of-network providers are available at no charge to the consumer. Again, other information says those medicines are actually not covered. That's a big difference, and this conflicting information could easily lead a consumer to make a bad choice when comparing coverage options.